Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us here today. I'm in studio with returning guest, Dr. Kelly Ryan. Now, she works in a very, very unique area of sports medicine as it relates to the horse racing industry. And she's here today to talk with us about some of the reasons that athletes in this industry may not seek treatment for a suspected concussion. Welcome back to Health Professional Radio, Dr. Ryan.
Thank you so much for having me back.
Glad to have you back. Now, you are with MedStar Health. Talk a little bit about your role there at MedStar Health as a sports medicine doctor.
So MedStar Sports Medicine is a large group who takes care of the majority of the sports medicine world in Baltimore and the D.C. area. We take care of we're responsible for taking care of the Baltimore Ravens, the Washington Wizards, a lot of the local colleges, DC United, the Baltimore Blast, just about every sport that you could think of. Until recently, I think when we added to our profile as well, and taking care of equestrian athletes, including the jockeys at the Maryland racetracks at Laurel, Pimlico, and as well as Timonium.
That's quite an extensive reach, and it's an extensive industry, the horse racing industry. You know, with an estimated anywhere from 8 to 10% of all jockey falls, either in a race or in practice or whatever, the falls result in concussions. Yet, according to a study last year at the University of Kentucky, there were 36 reported concussions among jockeys, 29 males, 7 females, at tracks in the United States between 2012 and 2015. With those numbers, a number of those concussions are still being unreported. They were unreported then, and they're going unreported as we come up on horse racing season. Can you talk about some of the reasons why some of these concussions are going unreported?
So the horse racing industry is very unique, and it's not really quite like any of the other sports teams. So if you think about it, when a player gets a concussion, whether they're on their college team, whether they're in high school, or whether they're in the NFL, there usually is an injury list, and they will still continue to be on that team, and it's expected that they will have time off for a concussion and, that they will have time to recover. However, the jockeys, they don't really work for a team. They work for themselves, and I hate to say it, but it's a very cutthroat type of environment. So the way that these athletes work is they wake up in the morning and they go from barn to barn or from stable to stable, working with different trainers, saying, hey, do you need me to warm your horses up today? Can I help you today? And that's how the trainers get to know the jockeys. And so the jockeys will exercise the horses in the morning. And I'm not just talking in the morning, we're talking like 4 or 5 o'clock in the morning they get up to go out and exercise horses. And just because they exercise those horses doesn't necessarily mean, one, that they're going to get paid, or two, that they're going to get to ride that horse when race day comes up. So horses don't actually race every single weekend. Sometimes it takes about maybe 3 weeks for them to recover. So you really have to kind of build up, I don't want to say your clientele, but you really have to kind of build up your relationships with these different trainers. And if you're not around because you're suffering from a concussion, well, you're not going to be there to warm up their horses, and they don't know that you're out on they have no obligation to you, and you have no obligation to them. Sometimes you can warm up a horse, and they might name another jockey on your mount.
Wow.
Yeah, so actually these jockeys have agents as well that kind of help them with these type of scenarios. But if you're gone for a couple of days, someone else is going to pick up your horses, and they might decide that they want to keep that jockey instead. So you might lose your chance, and you never know when you're going to find that Triple Crown.
So each jockey is basically an independent contractor.
Yes, exactly.
And you say working for himself. Why? I understand. The whole missing a day and someone else taking your spot, and the owners and trainers having no loyalty or obligation to you as a jockey. When it comes to the medical coverage that you're able to provide, do you ever run into resistance from some of the owners and trainers because they don't want to lose somebody for a couple of days? Is that something that, that you've encountered in this, as you say, cutthroat industry?
So in theory, this is something that I have continued to discuss with people from the racetrack, whether it's other racetracks, when we're talking to them about their concussion management, or when people are reaching out to us and saying, how are you doing this? How are you having these jockeys how are you having these jockeys listen to what you have to say? Because we're getting a bunch of resistance. They don't want to sit out. They just want to ride. And I think that the importance of that aspect is that we work with athletes. And so you have to know how to talk to them, and you have to make sure that you address their concerns, but you also have to make sure that you educate them properly. Once I start talking to my jockeys and we talk about the risks of them riding with the concussion, then they realize that, they might lose a mount or two, but it's better than losing your life. Because that essentially, unfortunately, when you're going 40 miles an hour and you have a fall and you make a bad decision, and it could be a catastrophic event. It truly could.
Absolutely.
Now, we are lucky and fortunate in Maryland, which is different than most of the other racetracks in the country, is that we are actually covered by workman's compensation. So if they do fall and they are suffering from a concussion, they at least will have a little bit of income that could potentially be coming in from workman's compensation, whereas
while they recover.
Yes, in the other racetracks, you don't ride, you don't make money. And every mount that they have, they actually get money for. So they'll get about $100 for each mount that they have. At our racetracks, we run about 9 races a day, and they usually will race about 3 days a week. Now, these jockeys aren't just going and riding at our racetrack, they're also riding at other racetracks. So they're going to Penn National, and they're going to Parks, and they're going to Charlestown. And so they're going all over and picking up mounts in other states as well. So that's actually one of the concerns that we have is, okay, so my jockey has a concussion, or there's a jockey from another racetrack that has a concussion, and how are we going to protect them and protect the other jockeys that will potentially be out on the track with them across the state. So that's been a challenge.
That's been a challenge. Now, you've teamed up with the MJC there in Maryland to create the Horseman's Health System, and you're talking about the challenge of providing adequate care to jockeys that are going to be traveling around the country. Is that something that you see being a more cohesive effort and more effective in the near future based on the Horseman's Health System? So
the Horseman's Health System is really our group in Maryland. However, through that, I've been speaking with other thoroughbred horseman associations from other states, and I've been speaking with some safety officials and from safety stewards. And, they've never really had sports medicine providers in their industry to really take a look at what's going on. So, we add a different perspective. I think, though, they've been teaching us just as much as we've been teaching them, to be honest with you, to understand your athlete, to know what their stressors are, to know what their barriers are. And that makes a difference when you're trying to reason with them and make sure that you're protecting them and making sure that they're safe and that everyone else is safe. So we have created a concussion protocol, and we've been sharing that with other states. And actually, New York is interested in starting a very similar program to us. Unfortunately, the racetracks are not as cohesive as one would hope. Like the NFL, there is an organization that has team physicians for every single team, and they have meetings, and there's guidelines across the organization, whereas this is left up to each individual track. So that is something who knows, maybe years from now we might be saying something different. And hopefully that's where we will be going with this.
And where can our listeners get some more information about MedStar Sports Medicine?
So you can get more information at www.medstarsportsmedicine.org. And then we also have a Facebook page that you could contact us there as well.
Great. Thanks for coming in and talking with us again today, Dr. Ryan.
Oh, of course. Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Kelly Ryan. We've been talking about sports medicine and as that sports medicine relates to the horse racing industry. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.